Welcome to step 2. It's time to feed your good bugs. Step 2 in your functional health recovery is all about feeding your good bugs and getting the bugs that you have already inside of you back into better balance. Did you know the average human small and large intestine carries about 3.5 to 5 pounds of bugs in it? And that you were bathed in your mother's bugs as you passed through the birth canal. These 3.5 to 5 pounds of bugs are broken up into 3 different types. The first type is called your essential or beneficial bugs. And these are bugs that you have heard of before, but every one of these bugs are absolutely essential for you to stay healthy. The second type of bug that we all have in our small and large intestine is called the opportunistic, or another way to put it is your bad bugs. And we all have them in our system, and these bugs mutate and become as individualized as your fingerprint. In a healthy gut situation, the essential or good bugs keep the opportunistic or bad bugs under very tight control. The third and final type of the bugs that are in your small and large intestine are called your transitional bugs. And they really tip the balance between the good bugs and the bad bugs. And these are the bugs that you usually take in with what you eat and drink every day. And as long as your gut is healthy and the good bugs are winning, they help you stay healthy. But if your bad bugs are winning the battle, then they can actually cause even further trouble. So with all this talk about bugs, what do you really need to know to stay healthy? What you really need to know is that approximately 90% of the genetic material that you are carrying around in you and on you right now are the bugs that you have. So you're only really 10% human. It is all about keeping the bugs that are in you and on you healthy. And really, nobody understood how important all the bugs that are in you and on you were until just a couple of years ago. But if you did not have the bugs in you and on you, your immune system just wouldn't work. Now that you are armed with this information, you're in the top 1 or 2% of the people that understand what it's going to really take to be healthy in the future. And so by keeping your bugs healthy, you will decrease the inflammation that you have in your body, and you'll have a much better quality of life. The balance between your good and bad bugs is ultimately important for you to stay healthy. Because if you have trouble with that balance, you will have low thyroid hormones, you will have immune issues, you will have increase in inflammation. And those 3 things lead to something that is called a leaky gut. And as that gut continues to leak, it will decrease the quality of your life. But if you balance the good and bad bugs in your small and large intestine, your ability to get your gut to quit leaking will be enhanced. So now that you understand why we need your good and bad bugs in your small and large intestine in balance, let's talk about some of the signs and symptoms of small and large intestine bugs when they are not in balance. Some of the most common small intestine signs and symptoms of imbalance in your good and bad bugs, number 1 is the leaky gut, and we'll be talking at great length about that in the future. The second is common food allergies. So often when your bugs are not in balance, you will have an increase in your food allergies. The third sign or symptom is constipation. So if you're not in balance, you will become more constipated. This fourth sign or symptom is being bloated. This is something that occurs so often, and you don't even have any idea that it had to do with your balance of the bugs. And then finally, a bug overgrowth can also be a very common sign or symptom that your small intestine bugs are not in good balance. Common large intestine sign or symptoms include loose stools, dehydrated stools. In other words, your stools actually look like they're dry when they come out and you look at them in your toilet. The third large intestine sign or symptom that you can see is yeast overgrowth. And these are things that you find where you'll have a lot of itching, have a lot of irritation when you go to the bathroom. And then finally, there could also be a fungal overgrowth, which means that there is also a lot of the irritation when you go to the bathroom. So these 4 signs or symptoms are also very common when you have an imbalance between the good and bad bacteria. So you might be wondering, where are all these bugs anyway? We all have bugs everywhere, from the tip of your tongue and your lips all the way down to the other end where you evacuate. But the first most important area of bugs is in your stomach. And we've all heard lately of what's called the H. pylori bug. And the H. pylori has been shown to be present in ulcers of the stomach, which is very true. But what you don't hear is that H. pylori is a normal part of the bacteria of the stomach, and the H. pylori will stay in balance when you have proper acid amounts in your stomach. When you don't have enough acid in your stomach, the H. pylori will become overgrown and you will actually cause ulcers because of the lack of stomach acid. The second important area of bug concentration is in the upper 2/3 of the small intestine. But in the upper 2/3 of the small intestine, the bug concentration is sparse because this is the area where most of the absorption of the nutrients occur. Remember, as the river of digestion flows downstream, the stomach will help to start to break down the nutrients. Then as soon as those nutrients start to come out of the bottom of the stomach, then the gallbladder, the pancreas, and the liver inject enzymes to help further break down those nutrients. And then in the upper 2/3 of the small intestine is where the majority of absorption occurs. The next area of bugs is in the lower 1/3 of the small intestine, and these bugs are reflecting the large intestine bugs to a great degree. If you have ever wondered where that 3.5 to 5 pounds of bugs live in your digestive tract, the majority of it lives in your large intestine. As a matter of fact, the normal bug population in your large intestine can exceed 100 trillion bugs. And don't think for a minute that your bugs are like anybody else's bugs in the world. Because once your bugs get into your digestive tract, they begin to mutate and change, and they become as individual to you as your fingerprint. Now that you have a better idea of where all the bugs are in your digestive system, what are their useful functions? The first major useful function of the friendly bugs in your digestive tract is they produce what's called short-chain fatty acids, which supply valuable fuel for energy for your body and for your health. The second vital, valuable function of the friendly bugs in your digestive tract is they produce a number of vitamins, notably all of your B complex vitamins and a vitamin called vitamin K. The third valuable beneficial function of the friendly bugs of your digestive tract is they all participate in the metabolism and the breakdown of different drugs, of different hormones, and even carcinogens, the things that cause cancer. They break down and neutralize many of these different things and make them harmless for you and your body. The fourth major useful function of the good bugs is they protect you from infection by the bad bugs. And they do this by taking up all of the available space in your large and small intestine for the bugs to congregate and to populate. So if there is not any space for the bad bugs to set up shop in your small and large intestine, then the balance between your good bugs and your bad bugs will always stay on the good bug side. The second thing that happens is that the good bugs also produce anti-bad bug substances that helps to kill the bad bugs and not allow them to populate and to get space in your large and small intestine. The fifth useful function of the good bugs is to help to maintain a healthy intestinal balance of the pH. The next major benefit of having plenty of good bugs in your small and large intestine is its ability to enhance your immune function. 70 to 80% of your immune response is directed by your digestive tract. So if you have a good balance between good and bad bugs, your immune response will stay on point and be very effective to tackle any kind of disease that comes your way. The final major benefit of having good friendly bugs in your small and large intestine is neurotransmitter production. Neurotransmitters are the hormones that are produced by these good bugs and allow your nervous system and your brain to function normally. The best resource I have ever come across that talks about how neurotransmitters and the good and bad bugs that are found in your digestive tract are related to each other is this book. And it's called Gut and Psychological Syndrome by Dr. Natasha Campbell McBride. This book gets into great detail about the relationship between your neurotransmitters, or what causes a lot of your behavioral issues, and your gut and the good and bad balance between the bacteria found in your small and large intestine. As you can see, these syndromes can be a leading factor in autism, in ADD, ADHD, in dyslexia, even depression and schizophrenia are related directly to the balance between your good bugs and your bad bugs in your small and large intestine. So now that you know where your good bugs are and the benefits of having plenty of good bugs, how do you get your bugs in the first place? You get your bugs in a combination of 4 different ways. But remember, you get both your good bugs and your bad bugs the exact same way. So that is why it is very, very important to be conscious of this and making sure that you're really working to get more good bugs in your system. The first and most common way we all get bugs, both good and bad, is through eating food and drinking liquid. This is the body's most efficient way to get good and bad bugs. The second most common way we get good and bad bugs into our body is through our lungs. When we breathe in good and bad bugs, as well as viruses and yeasts and parasites. But then we also, as we exhale and breathe out, many of these bugs get expelled, and so they don't cause us trouble. The third most common way to get bugs into our system is through a break in our skin. Most people don't realize that the skin is also part of our immune system. It keeps good bugs in and keeps bad bugs out. But when there is a break in our skin, it can allow bad bugs to get into our system and cause an infection. The fourth and final way we get good and bad bugs into our body is through sexual contact. Anytime you have a sexual encounter, you are transmitting both good and bad bugs between the two partners. The four different ways that I've just described how good and bad bugs get put into our body are extremely important. But there is absolutely nothing more important than the mother providing the baby with a lifelong bug fingerprint during birth. When a baby is born, the mother transmits her bug fingerprint to the baby so that the mother's bugs are now part of the baby's bugs. As we just talked about, when you are born, your mother provides you with the bug fingerprint that you are going to build upon for the rest of your life. So how you came into this world is an extremely important part of your future bug health. Now that you realize that your first bug fingerprint came from your mother, you need to think about how you came into this world. If you came into this world as a normal delivery, you were provided your bug fingerprint from your mother's birth canal. And approximately 2 weeks prior to your delivery, the dominant bugs called lactobacillus were getting built up in your mother's birth canal. And these bugs helped you digest your mother's milk. The next very important part of the normal delivery process as you're going through the birth canal is that there is a slippery slime that surrounded you as you were going through your mother's birth canal. And what that slippery slime did is it helped to capture the good bugs that she was passing on to you, and it also made you slippery. But now let's say there was some reason that you could not be delivered normally, and you were delivered by C-section. C-section babies do not get exposed to the mother's bugs. And because C-section babies don't go through the mother's birth canal, they do not get the transfer of the mother's bug fingerprint. What happens is as they come out and as they reach air, they become inoculated with the airborne bugs that are found in the delivery room. And usually these bugs are skin-loving bugs and not the same bugs that help you digest milk. And what I mean by skin-loving bugs is that the airborne bugs that are found in the delivery room actually like to eat and digest skin. So when those bugs become the dominant fingerprint of a baby's digestive tract, they run into trouble digesting milk. So when C-section babies get the wrong types of bugs to start to populate their digestive tract, they start to have a lack of the milk digesting bugs. And that can lead to problems with breaking down the mother's milk. This is one of the main reasons that C-section babies are more likely to be colicky babies, to have digestive issues, to have immune issues, because if you don't get the right fingerprint from your mother, then your chances of having problems down the road are much greater. Now that you understand how you got your first fingerprint of your bugs, either through your natural delivery from your mother through the birth canal or by C-section, what are the other factors that can disrupt the balance of the bugs in your intestines and can lead to problems? The most important factors that will get your bugs that you have inside of you right now out of balance from good to bad include antibiotic use, the use of birth control pills, the use of outside hormones, especially steroid hormones, the standard American diet, excessive use of alcohol, increased stress. What you eat affects your gut bugs for the next 10 days. So any time that you put something into your mouth, for the next 10 days, it is going to have an effect on the balance between your good bugs and your bad bugs. One of the main ways that you can change the balance between good and bad bugs is by the use of antibiotics. But antibiotics are just one of 3 different types of biotics that you need to understand. The discovery of antibiotics back in 1921 changed the face of modern healthcare forever. Because up until that time, trauma led to infection, and infection killed the majority of people after a trauma. And so as the antibiotic revolution started to gain strength, all of a sudden now a terrible infection wasn't a death sentence anymore. If you got the antibiotics into your system fast enough, you could stop the infection and kill those bugs and therefore live past what everybody else was able to do up until that point. With the fabulous success of antibiotic use having the ability to stop infection, this fueled the pharmaceutical revolution of modern healthcare. As the pharmaceutical revolution continued to gain steam, they figured, let's come up with other pills that help with other disease processes. This idea has led to the one pill for one ill concept of modern medicine. Now let's fast forward almost 100 years. We are now using antibiotics much less than we used to because now we have discovered that there are really good bugs that are necessary for health that are found in your digestive tract. This brings me to the second type of biotic, and this is called a probiotic. Probiotics have been known since the early 1900s, but the actual term probiotic was coined in the 1980s. Probiotics are usually given in a capsule form and provide your gut with specific types of good bugs that help to change the balance and get the good to bad bug balance back to where it belongs. The final type of biotic we all need to understand is prebiotics. And the prebiotic term has only been around since about 1995. And a prebiotic feeds the bugs that you already have inside of you. A really good example of a prebiotic is soluble fiber. Soluble fiber provides the food for the good bugs that you have inside of you. To summarize, there's 3 different ways that you can change the balance between good and bad bugs in your small and large intestine. The first way is by using an antibiotic. And an antibiotic will kill both good bugs and bad bugs. The second way is by using a probiotic. And a probiotic is usually a capsule that will provide your gut with specific types of good bugs to help to populate your gut after antibiotic use has killed a lot of the bugs that were there beforehand. And then finally, the third way to change that balance is by use of a prebiotic. And prebiotics are used to feed the good bugs that are already inside of you. Now that you have a better idea of how your good and bad bug balance can be manipulated in your small and large intestine, let's look at some specific imbalances that are very common that you might be dealing with right now. Two researchers by the name of Galland and Berry categorized 4 different types of good and bad bacteria imbalances, and so we're going to spend the next couple of minutes explaining each one of these and seeing if they make sense to you. These researchers discovered the 4 basic types of imbalances between your good bacteria and bad bacteria are putrefaction, fermentation, a deficiency, or sensitization. The first imbalance between good and bad bugs in your digestive tract is called putrefaction. And this problem is caused by diets too high in animal fat and too low in insoluble fiber. You need a lot of good quality fats in your diet, but you also need to have plenty of insoluble fiber so that then they work together to get rid of the toxins in your small and large intestine. So if you eat too much animal fat and you don't eat enough insoluble fiber, this decreases the bowel transit time and increases the concentration of bad bugs that kill the healthy bugs. So you need to make sure that if you're eating a good amount of animal fat, that you are also eating enough insoluble fiber so that then you can get things moving and keep things moving throughout your small and large intestine. So if you're eating enough good fat, but you're not eating enough insoluble fiber, this increases your colon cancer risks because the putrefaction that occurs increases the number of bad bug enzymes, and that can interfere with your body's ability to clear hormones. If you're eating enough high fat and not eating enough soluble fiber, this also increases the production of ammonia within your small and large intestine. This has a negative effect on many bodily functions, especially liver and kidney detoxification. So to summarize, the first type of imbalance between good and bad bacteria in the small and large intestine is called putrefaction. And the way to stop putrefaction from occurring is as you eat more good fats, you also increase the amount of insoluble fiber that you put in your diet. This allows both the fiber and the fats to pass through your small and large intestine faster and lead to less putrefaction. The second type of imbalance between good and bad bugs is called fermentation. A fermentation bug imbalance is also referred to many times as a small intestine bacterial overgrowth, or easily termed SIBO. This problem is many times indistinguishable from a yeast problem. People who suffer from a fermentation bug imbalance or SIBO have issues with carbohydrate intolerance, diarrhea, anemia, weight loss, malnutrition, gas, and abdominal pain. There is a reliable test for SIBO, or fermentation bug imbalance. It's called the breath hydrogen test. The amount of hydrogen is measured after a sugar solution is given, and an increase in the amount of hydrogen is a positive test. SIBO problems, or fermentation bug imbalance problems, are made worse by not enough stomach acid, by slow bowel transit time. In other words, your food and your diet is not moving through your digestive tract quick enough. It also is made worse by immune problems and by malnutrition. SIBO, or small intestine bacterial overgrowth, is one of the most common balance problems between good bacteria and bad bacteria. And this problem is made worse because of the valve that is in between the small intestine and the large intestine. The valve between the small intestine and the large intestine is usually closed very tightly and only opened when the contents of the small intestine is very fluid and ready to be emptied into the large intestine. But when there is problems with the balance between the good bugs and the bad bugs, this valve has extra pressure put on it, and chemical irritation relaxes this valve and excites the peristalsis, which means excites the movement of the contents of the small intestine into the large intestine too fast. One of the main causes of small intestine bacterial overgrowth is that there is a valve that runs between the small intestine and the large intestine. And this is a one-way valve. This valve is only supposed to allow content to go from the small intestine into the large intestine. But when you have a bacterial overgrowth and imbalance between the good bugs and the bad bugs, pressure or chemical irritation can develop and actually cause a backflow of content from the large intestine into the small intestine. And when this occurs, you have an increase in gas, bloating, irritation, and this is where SIBO becomes a real big issue. Here is a picture that demonstrates the normal distribution of the intestinal bugs in your small and large intestine and what a small intestinal bacterial overgrowth looks like. The top picture talks about the three different parts of the small intestine and the colon, which is another name for the large intestine. There are three parts to your small intestine: the duodenum, the jejunum, and the ileum. And then the colon is another name for the large intestine, and right between the ileum and the colon is that valve that we just talked about. When food is digested normally, and easily digestible foods like rice, as you can see in this top picture, the food goes along and is absorbed in the duodenum and jejunum, and by the time it reaches the final part of the small intestine, called the ileum, digestion and absorption is complete. Now, on the other hand, if you have poorly digestible starches like beans, so often what will happen is that the digestion will continue all the way down into the colon. And this is where the gas and the bloating and the irritation comes from when you're eating beans. So now let's look at the bottom picture. And this bottom picture depicts a small intestinal bacteria overgrowth from the large intestine and into the small intestine. As you can see in the top picture, the deep green bacterial concentration in the large intestine stops where that valve is between the small intestine and the large intestine. But if you look at the bottom picture, that deep green increase in bacterial concentration has now migrated all the way into the small intestine, and you can't even see where that valve is anymore. And this depicts the bad bacteria that has migrated through that valve and into the small intestine. So in the case of a person who has a small intestinal bacteria overgrowth, or a problem in the balance between their good bugs and bad bugs, you can see that even easily digested starches like rice, as they continue to go down and be absorbed in the small intestine, they reach these new highly concentrated bugs and cause even further gas and bloating and irritation even before they get to the bottom of the small intestine. Let alone if you have a poorly digested starch like beans, because if you eat beans and you have a problem between your small intestine and your large intestine, it will really blow up and cause even further fermentation or gas to occur. So what exactly do we mean by fermentation? Any carbohydrate you eat can be fermented by the bugs in your large and small intestine and produce toxic waste products. And dietary sugars can be fermented to produce alcohol. And chronic exposure of the small intestine to alcohol may impair intestinal absorption or cause a leaky gut. When you're fermenting too much, starch, simple sugars, and soluble fiber can actually make the problem worse. And so a diet free from cereal grains and added sugar is definitely recommended until you get this problem under control. Fruits, fats, and starchy vegetables are tolerated differently by each individual. So you have to really monitor your diet and see how much of these 3 different types of foods you can tolerate until you get this problem taken care of. The third type of imbalance between your good and bad bugs is called sensitization. And this type of bug imbalance occurs when there is an increase in the immune response to your good intestinal bugs. The bad intestinal bugs actually create their own antibodies to attack the good intestinal bugs. When the immune system becomes sensitized, the bad bugs actually create their own antibodies and causes even further havoc to occur in the small and large intestine. In one study done in the King's College in the UK, they found these increased antibody levels in the majority of their irritable bowel disease population. And to make matters worse, sensitization and fermentation bug imbalances can be found in the same person. In other words, somebody who is having problems with a small intestinal bacteria overgrowth can also have problems with their immune function, and these people have terrible issues that need to be addressed right now. The fourth and final bug imbalance that was discovered by Galland and Berry is called deficiency. And this is due to the use of antibiotics and the low amount of soluble fiber that is found in the standard American diet. And this can create an absolute deficiency in the normal bug balance and population. When you just don't have enough bugs in your system and you have a deficiency, this is associated with irritable bowel syndrome and with food intolerances. Just like you have people who have a fermentation and sensitization bug imbalance at the same time, you can also have a person that has a deficiency and a putrefaction bug imbalance at the same time. Because when you don't have enough bugs overall, then the bugs that you have are not enough to digest those foods properly. And this leads to putrefaction or rotting. So now that you have a much better understanding of the good and bad bug imbalances, have you ever wondered what the appendix is for? We have all been told that it's just sort of extra and that there really isn't a good reason for it to be there. But that's absolutely not true. And it's especially not true during childhood. Because what they have recently discovered is that the appendix contains good bugs that live on the biofilm that is in the appendix and that can repopulate the large intestine after an exposure to a gastrointestinal infection or food poisoning. So in other words, it is the seeds that is necessary for you to have good bugs in your large intestine forever. So with all this talk about bugs, why is fiber important? You have two types of fiber. The first type of fiber is called insoluble fiber. And insoluble fiber acts to move undigested food through your digestive system. Think of it as bulk. It is what is necessary to keep food moving correctly through your system. The second type of fiber is called soluble fiber. And soluble fiber shortens bowel transit time, it increases stool bulk, it holds water, it forms gels, it binds toxins, it promotes bacterial growth, and it ferments short-chain fatty acids. And short-chain fatty acids are the energy sources for your muscle cells. Soluble fiber is the most important fiber, in my opinion, because it acts as also a prebiotic, which we talked about earlier. Soluble fiber is also a prebiotic. And remember, a prebiotic is the food of good bacteria. So what do you really need to know about step 2, feeding your good bugs? The first thing you need to know is that 90% of the genetic material you have right now is from the bugs that you have in you and the bugs you have on you. And only 10% of the genetic material you have right now is actually human. The next thing you need to know is you get your first bugs during the birthing process. In other words, as you come into this world is when you get the first bacteria that is being inoculated into your gut. You also need to know that there are 3 different types of biotics to be concerned about. The first is antibiotics, which kills bugs. The second is probiotics, which is what gets bugs into your system. And then the third biotic is a prebiotic, and that feeds the bugs that you have in you already. And finally, you need to understand that there are 4 different types of balance problems with your bugs. All 4 of these types can occur simultaneously, but any one or all of these things will cause you trouble with your energy, your mood, and your overall health potential. So all of these have to be addressed in order to move on to step 3.